Like to get started on time, so we have plenty of time for our speaker and our case discussion. Welcome to Project ECHO-Geriatrics for December. It's our last one of 2023. It's hard to believe, but I'm so glad all of you joined. I'm Kate Bennett. I'm the medical director for ECHO-Geriatrics and a geriatrician over at Harborview in Seattle. We have a really great session planned for you today. First, as we always do, we'll have a short didactic, and today we have a speaker who will be familiar to a lot of you who've been on previous sessions, Breanne Swanson, who I'll introduce in a second. And then after that, we'll have a case discussion by Dr. Pareto, who will talk us through a challenging case scenario and share his expertise a little bit too. So looking forward to that discussion with all of you. It looks like, as happens sometimes with Zoom, our chat function isn't working. So we're going to be extra interactive today. If you have a question, please feel free to unmute yourself for that. And during the time when we're doing the case discussion, just go ahead and unmute to ask your question. I think we can make it work just fine. If we can get the chat enabled, we'll do it, but I think it might be kind of stuck where it is right now. So anyway, that's one of the things with technology. You never know what you're going to get, but we'll make it work, and it's going to be great to hear all of your voices. So I'm going to go ahead and turn it over to Breanne Swanson. She is the primary care liaison at in Vancouver, Washington. And Breanne, I'll let you introduce yourself, but I just wanted to share with all of you that I didn't know what area agencies on aging were until I had been a geriatrician for a couple of years. And once I found out what an area agency on aging is, I couldn't believe that I didn't know this for the rest of my medical training and time in my career, because it's really the area agencies on aging that connect us with all of the community resources that help older adults age in place and have the quality of life that they want right in their homes. So Breanne's going to tell you about the AAAs. It's something that all of us who care for older adults should know about, and I'm glad you're finding out sooner than I did. So thanks, Breanne, for coming to talk to us.
Yeah, you're welcome. Thank you for having me out. Let me share my screen here. So I'm with Area Agency on Aging and Disabilities of Southwest Washington. I've been here for about 12 years. I've worked in a lot of our different programs. And what Dr. Bennett said is something we hear often, that people don't know about us until maybe it's too late. Oftentimes we hear people coming in saying, gosh, I wish I would have known about you guys 10 years ago when I was taking care of my mom. We've been here the whole time. So we don't want to be a best kept secret. So I hope that this information is helpful for everybody today. And I guess I'll go ahead and get started. So I also wanted to just give a shout out to my co-primary care liaisons, Felicia Sanchez and Fong Nguyen. They're at two other AAAs in the state of Washington, and they helped me put this presentation together. We do not have any disclosures. So to get us started today, I'd like us to take a minute and just really reflect on our own wishes for the future and our own needs as we age. So when we envision the last years of our lives, nearly everybody is envisioning those years in the comfort of their own home. So AARP did a study of this a few years back, and they found that over 90% of older adults want to stay in their own homes as long as possible. And I'm guessing this probably isn't a surprising statistic to many of you, because I know for myself, that's where I would envision myself. It's where my family envisions themselves. But what most people aren't realizing is how difficult this might actually be to accomplish this goal on our own without help. So to continue to live independently, many people are eventually going to need some level of service or support or assistance to continue to live safely and successfully in their own homes. So you guys know better than most, as people age, they're beginning to experience additional difficulties in physical functioning, and a lot of people are going to end up in the role of a caregiver for someone with difficulties with physical functioning, whether that's a role they were looking for or not. So a lot of people are going to be facing unexpected challenges that is going to make staying at home just a little bit more difficult than maybe they would anticipate. So that's really where agencies on aging come in. These are a nationwide support that it's available across the country. There's over 620 of us nationwide and 13 of us in the state of Washington. So area agencies on aging, call ourselves AAAs for short. We were put in place through the Older Americans Act back in the 70s, and we are primarily tasked with being the boots on the ground organizations that help people live with independence in their communities and help them remain at home. That's our whole goal. So most people who are familiar with the agencies on aging, especially in Washington, you know about us because we have fantastic programs that we offer for in-home care. But what a lot of people don't realize is that we really do a lot more than just in-home care. So area agencies on aging are involved in the planning, the development, the coordination, and the actual delivery of a wide variety of services and supports that are really all there with the sole goal of helping people remain independent, helping them remain in their own homes, because that is what matters to a lot of people. So per the Older Americans Act, in order to have this designation of area agency on aging, an agency is required to provide 5 core services. So these are things that you can expect to find in any region of the country and any region of Washington state. So I'm going to talk a bit about these during the presentation today. So there are always going to be elder rights services. So those are types of services that can help with protection and prevention from elder abuse. There's going to be services and supports to help unpaid or informal caregivers. We call those family caregivers. There's going to be senior nutrition services. There's going to be evidence-based health and wellness programs. And there's also going to be supportive services, which is honestly a very broad category that a lot of different things fit into. That might include things like transportation, job training, all sorts of things. So I'll speak to these in a little bit greater depth, but just know that these 5 basic services are going to be available everywhere. But the individual services that actually make up these different domains, they're going to look different depending on where you are. So I'll start off today with probably one of my favorite domains to talk about. This is the domain of services for unpaid or informal family caregivers. So again, a family caregiver, it's a little bit of a misnomer. It's somebody who helps a friend, a neighbor, or a loved one, and they're not paid to do it. They don't have to technically be related, be family members. That's not important to us in Washington. What matters is that they're not paid to provide the care that they're providing. So these are folks who are helping with ADLs and IADLs from a loved one. A lot of these folks are not going to think of themselves as a caregiver. They may not call themselves a caregiver. They're just somebody who helps mom or somebody, who helps their spouse. And these folks are absolutely critical to the health outcomes of your patients. They are generally not trained in any of the care that they're providing. This can be a really overwhelming job that people have taken on. And these folks could really use some more support and information. So area agencies on aging have some really wonderful services, especially in the state of Washington. We're really lucky to have such robust services for family caregivers. There's a couple different programs throughout Washington that provides this type of support, so we can really serve people at different income and resource levels. So our family caregiver support services allow people to access things like a case manager who can really be like a life raft in a storm for a busy caregiver who's feeling burnt out. We can help people get a break from caregiving. We can help them make plans for what the future might look like, because there's often a lot of
Denies fever,
uncertainty.
chills, nausea,
And
vomiting, or back pain.
Hold on one second. Dr. Brown, I think you're unmuted. I think you're unmuted.
And then we can also help them connect to support groups that might be available for them, find local resources to help make that caregiving easier. We can help them connect with specialized training or education that might exist to help make decrease their burden of caregiving. Some agencies on aging might have funds available to help with things like medical equipment, supplies, things like emergency alert buttons. We've got a lot of really great ways that we can help unpaid or informal family caregivers. So just keep that in your mind when you're working with somebody. The next domain is nutrition. So senior nutrition services, they really encompass a couple different things here in Washington. Most of you, I'm guessing all of you actually, are probably familiar with home delivered meals. But what most people don't know is that area agencies on aging are stewards of the federal funding that provides home delivered meals for older adults in their communities. So while we may not be the actual entity that is delivering the meals to seniors, we are likely contracting with the group that is doing that and paying them to provide that service. There's also what a lot of people don't realize is there's congregate meal sites that are available. So this is nutritious meals and social engagement and access to other services like health promotion activities. They're really great. They often take place at senior centers, community centers, Grange halls. They're really great sources of socialization if you have any patients who are needing nutrition and socialization. And then there's also senior farmers market nutrition vouchers that are available. And that helps older adults below a certain income level access fresh fruits and vegetables every summer at their local farmers market. The next domain is supportive services. So within this domain, I really want to specifically highlight case management and care planning that is often offered through the area agencies on aging. All of our agencies on aging in Washington are offering case management services. And so this is a type of service that can help assess the needs, develop care plans, authorize and coordinate service delivery so that people can help receive those services like in-home care to help them stay home. Some other common supportive services that are often offered at AAAs might be things like information and assistance services. You're going to be able to get that everywhere in Washington. Sometimes they're agency aging and disability resource centers, so they can have a couple different names. There's often in-home care, which again, everywhere in Washington. Medicare counseling, transportation. There might also be things like social engagement opportunities, home modification programs, emergency alert buttons. There's really a lot that agencies on aging can do that fall into this category. Within the domain of health and wellness, area agencies on aging are required to offer evidence-based programs. And our health promotion programs really are designed to empower people to self-manage and improve their own health with a focus on promoting their health and well-being through things like exercise classes. We have different educational programs and workshops that people can take. A lot of the specific programs that we're working in terms of like our assessment protocol are evidence-based. So we really are a great source of health and wellness resources and materials for your patients. I think this is the last domain is elder rights. So area agencies on aging have played a pretty significant role in detecting and preventing elder abuse since their inception. And so part of that is because we have, in Washington at least, we have folks who are going out into the homes, and their case managers. We're going out, they're seeing what's going on in the homes, and they have their finger on the pulse of what is happening with these patients. And they're reporting those things if there's concerns to adult protective services. So we can really help keep people safe. Additionally, some of the more formal services that fall under this domain are things like the long-term care ombudsman. So that's a volunteer-based service for people who live in a facility of some sort, like assisted living, adult family home, or a nursing facility. It's somebody who can advocate for those residents' rights. There may be advanced care planning resources at your local agency on aging. Your local agency on aging likely provides some funding for senior legal aid groups to provide that service at a state level. And then we can also provide connection to dementia legal planning information and resources. So while we're not offering legal services ourselves, for the most part, I think we can get people connected to these types of services that exist that are really necessary for a lot of folks. So I guess hearing all of this, oftentimes by the time I get to this point in the presentation, people are like, how do I refer to you? How do I get my patients your way? Because you may have somebody in your mind already that you think might benefit from these types of services. And so the easiest way to do that in Washington is to use the Community Living Connections website. So this is just kind of a screenshot from that. There's a referral button over here. This is a HIPAA protected referral portal specifically for healthcare providers to use. And this will go get the referral directly to your local area agency on aging. So it's a really great thing to do to make the referral on the behalf of your patient. And I know it adds an extra step for you guys, but you're going to reduce those barriers that they face in connecting to services, because so often they don't know where to start. They're coming to you asking for this advice. That's where most people will go for help first in terms of aging in place resources. They'll go to their healthcare team. They won't seek out a service like us first because they just don't know we're here. So if they're, especially in the case of an overwhelmed caregiver, oftentimes like a brochure for your local agency on aging is going to be the last thing that they get to. So if a healthcare team could make that referral on the behalf of the patient, they're going to be more successful in getting connected with services that are going to help them stay in their own home and stay independent. So on this referral portal, just a couple things to keep in mind is it's important to ask the patient for consent, because they're going to be more aware to be expecting a call from one of our resource specialists or case management folks, and then more likely to engage with us as a result. You'll need to provide their contact information as well as a little bit of demographic information, like a birth date is always helpful. And then let us know what kinds of services and supports this person is needing. You don't need to know specific names of individual programs, but if you can give us some heads up, like, hey, this person is really struggling with falls, or they have a family member who's taking care of them who's struggling to do that, and they could use some support groups. Little things like that are going to be really helpful for us establishing rapport with the patient and getting them connected to services. And then it's also really important for us to know communication considerations. So like if your person has cognitive impairment or is hard of hearing, or maybe they don't speak English and they'll need an interpreter, please let us know that when you make a referral, and we can do our best to, use an interpreter or reach out to them in a way that's going to be person-centered so that they're able to receive the information appropriately. So when you submit a referral to an agency on aging, these are generally going to what's called an information and assistance department. In some places, they're aging and disability resource centers. Some people just call them the community living connections. I know that's what King County does. But these teams that field the referrals are essentially the front door for services. So these are single points of contact that can help patients connect to supports and services. They do kind of the initial screenings to help people understand what their options even are. So when you submit a referral, it's not like you're applying for a service formally. You're letting us know this is a person who needs services, and we will help them decide what type of service is going to be the best for them. And the great thing about the folks who field these referrals is that they provide unbiased information. Like, we are not for-profit businesses. So you can truly trust that people are getting, unbiased, reliable information that they can trust when they're reaching out to an agency on aging. So in sum, as you can see, agencies on aging, especially the ones here in Washington, are really great at taking a person-centered approach. So we are experts in providing information, assistance, support, and services that really focus in on what matters to an older adult. And we can be a great piece of helping you guys provide that age-friendly care in terms of what matters to people. So some agencies on aging may also have different resources on some of the other, like mobility, medication, and mentation, but that's going to be different at each agency on aging. So you'd want to reach out to your local office. So how can healthcare professionals help? So it's important to be on the lookout for older adults who are struggling with their ADLs and their IADLs, check in with those support people who are routinely attending your patient's appointments, because those are likely unpaid caregivers or family caregivers in some way, shape, or form. So it's really important that we clue those people in that services are available for people like them. Perform cognitive screenings early to help catch dementia, because we have a lot of great resources to help people who are living with dementia or are caring for somebody with dementia at the AAAs. And then lastly, refer patients to us. We're here, we have capacity to serve people, and we would love to see how we could help your patients stay in home. So in sum, the agencies on aging are the right place to go to connect older adults and their families to a wide range of services and supports that promote independence and aging on place. And that's it. Thank you.
Thanks so much, Breanne. That's really helpful. Such a wealth of services related to the things that are most important to the older adults in the community and their caregivers. We have time for questions. Our chat function isn't working, so please unmute to ask your question. Yeah, go ahead.
Sorry if I missed this, Breanne. Thanks for this great presentation. Did you talk about respite? I feel like that comes up a ton.
Yeah, so I don't think I mentioned respite specifically by name, but respite falls under the category of services and supports for unpaid or informal family caregivers. So there's a couple of different programs that offer respite care specifically in the state of Washington.
And do you know the answer to this question that often comes up as well, which is this available to folks who don't have Medicaid?
Yes, definitely. So there is a program in Washington that it's called Tailored Supports for Older Adults. It's often called TSOA, and that has more generous financial guidelines for people who are kind of in that pre-Medicaid phase. Like they still have fairly high resources, they can have fairly high incomes, but if they were going to get placed in a facility for more than a month or two, that would significantly deplete their finances. So we have services for folks like that. And then there's also another service that really, depending on where you go in the state, they may have more financial criteria or not. At our local level here, we can serve people at any income or resource level on one of our caregiver support programs. So it's really all going to depend on what is individually being offered at your local area agency on aging.
Great. Thanks, Breanne. Ash, you had a question. Feel free to unmute.
Thank you for this presentation. I kind of had a question, kind of building on what Dr. Rubenstein kind of asked. I guess like if when patients, you present this to them, they might be like, oh, what is this going to cost me? Because of course, like everything, especially like when you're older, it's just like there isn't a lot of money and like a lot of things are very expensive. So I guess like it's covered by insurance. And I guess you kind of like mentioned like with Medicaid, there are extra resources, I guess.
So we are a free resource, like to refer to us, free, to talk to us, totally free. Most of the services that we're offering are going to be totally free as well. There may be a couple programs that have like a sliding scale fee, or like a Medicaid program might have a copay called a participation for in-home care. But we are really, the place to go to get that free, unbiased information for services that are going to be either free or low cost.
And then I had another question, I guess I know like we have like 13 agencies, so of course it depends on like where they're at, but for like people that would be in a more rural place and not close to anything, like, and they might not be able to travel because as they're older, they might not have the capability to transport. Are these services that kind of like maybe go out to these people, or like how does that work?
We do so much at the agencies on aging. It's hard to answer that question specifically, but like an example would be the in-home care programs, or programs like family caregiver support. That is available everywhere, even in completely rural, isolated communities. That's a service that people can access. But the way that accessing that service might look in a very rural community might be very different than somebody who's going to be accessing it, let's say in downtown Vancouver, a big city in Washington. They may have a lot longer wait times to get the services in place, to get a caregiver in their home, because there's a pretty significant caregiver shortage in rural areas. And then there may be less choice in terms of types of services available. So whereas in a major city, you may have like 5 or 6 different free exercise classes that you could possibly attend. In your local community, there may be one, or it may be in the largest city in that county, but you live 100 miles from that city center. So it's hard to say just because I'm just from one agency on aging and I can't speak to what's going on completely at the state level, but that we cover, agencies on aging cover all of the different counties in Washington.
Thanks, Breanne. Other questions? Feel free to unmute if you have a question. All right, I think you answered all of our questions. So thank you for doing that. Thanks for the wonderful presentation, Breanne. I always love hearing